Welcome to Ask Dr. Melinda, Aging Gracefully and Strong, bringing you cutting edge trends in holistic and integrative medicine on IQ Podcast at Attorney King Studios. Well, I have a very special guest with me today. This is
Yes.
David from
Hello,
Global Whole
everyone.
Health Corp. And we're going to talk today about the importance of COVID testing. And it's a very, very important topic right now.
Also, the importance of being home and, keeping safe, social distancing, everything that you have to do, and why testing is important for us right now to be able to not just reopen the economy and reopen everything that is important to us, but also, to make it safer if you want to hang out with your friends, the social aspects, as well as to everything that it comes with COVID testing and why COVID testing is going to improve our social standpoint currently.
No, it's important, especially nowadays when it is unfortunately not really controlled. I have some statistics here. I just wanted to read out in starting with Arizona with 157 new deaths on Thursday, a single day record, according to New York Times. Florida set death records 3 days in a row this week, and California also set back-to-back records. So I really think that the testing is so relevant because of what you said, and just so that we can get control of this deadly virus.
Yeah, just make sure that because how you explain it, just that control and everything that we have to do to make sure that we stay safe and that we prevent people from dying, which is the most important thing. I mean, I feel to us as people, as humans, that other people are dying, and that's important to us.
So tell me a little bit about your corporation. It's the globalwholehealthcorp.com. I know that this is a family business. Your father is CEO. I'd like to introduce him. His name is Charles Strongo, and he is on the line with us. Are you there, Charles? Can you hear us?
Hi, how are you?
Hi.
Thank you so much.
Hey.
Thank you for the opportunity.
Well, I'm so glad that you're here with us today. Can you tell me why you started doing the COVID testing and why you think it's important?
Sure, thank you. When this COVID-19 really began to appear in late December, early January, first in China, and then here in the United States, we began to hear about it. And Global Whole Health Partners has been experienced in making unique tests. And when we heard about this test, knowing that it's a coronavirus, and we've already had worked with MERS and with SARS before, we felt that we would be able to hopefully develop a coronavirus test and be able to help test people in the United States and around the world. And so we started development and working on a test for the COVID-19. And so we knew that this was going to actually spread. We had a lot of insight from different people from different countries, and we knew that this was going to spread in early January. And even though it wasn't considered a full pandemic yet, we had insight that it was heading to the U.S. and then to the rest of the world, and it did. Unfortunately, sometimes you wish that you're wrong. You wish that the scientific statistics are incorrect, but when they are, you try to be prepared for them. But now that it has, our goal is to help as many people remain safe and to test as many people as we can to keep them safe.
Well, it's nice that you already have experience with the previous testing. I know that you guys, the test that you have is an antibody test right now. And
yes.
Can you tell me what is unique or special about that test compared to the other tests that are out there?
Sure. There's a lot of wonderful antibody tests that are out there. Some, we call them two-line, where it's a control line and the antibody antigen are all on one test line. But a person or a doctor or physician that's actually evaluating cannot differentiate if it's an IgG or IgM or basically the G or the M antibodies.
That's why
And
we
that's
have
important.
a 3-line test, right?
Right, that's correct. And so by offering the 3-line test and being able to have a test that on we call it a strong positive, we can know in 4 to 5 minutes. Our test is total overlook is 10 to 15 minute test. It's something that's rapid, it's quick, it doesn't need a machine, and it's a wonderful screening device. Is it completely definitive? An antibody test is not definitive. But is it a screening test? Yes. It's a very good screening test.
I actually have used it in my office, and it's actually very easy to use. And one reason why I really like it is that there is a high sensitivity and high specificity for this test. And it's really important because a lot of people don't understand that even though there are a lot of antibody testing available, you want to make sure that the sensitivity is high, which means that it's a true positive, that you're, and that there's not going to be as many false negatives, and that there's a high specificity as well. And I think that's what sets your test apart. Isn't that right?
Yeah, the biggest thing
Yeah.
that causes our tests to be set apart is that our overall accuracy, this is not including the new studies, which my father will cover, but the overall accuracy on the old studies was in a total of 98%. And that's actually very, very accurate in comparison to a lot of the tests that are out there. But he will cover the new specificities and new sensitivities, which, according to the new tests, our tests have become better.
Yeah, can you speak on that, Charles?
Yes, thank you. As you develop a test and then you continue to try to continue on, and you work with all the scientists and people that are working with it, and by going to the factory and talking to everyone, you're always trying to improve what you have. We don't ever believe in status quo. We believe in always trying to perfect. And so, in ours, our sensitivity has gone up about almost a full percent. So we're running 98.9, 99.1, which is very good. And our negatives, we've been running 100% correlation. Our last study of 124 tests, we ran 100% correlation to a PCR machine.
Meaning?
That's very good. Meaning that we didn't have any false positives or false negatives.
And that's exactly what we're looking
That's
for
true,
in
yeah.
an accuracy of a test, right?
Well, what I like is that you have it accessible. You are a San Diego company, actually based in San Clemente. Is that right?
Based in San Clemente.
Yeah.
Based in San Clemente. So I really like that it's very accessible, that they're made in the USA, which I really like. And I like that you have the high sensitivity specificity. I know that there's a newer test that's coming out on the market, which is an anagen test. Can you speak about that? Because that's the newest test that will actually show that people are actively infected. And that test is not readily available to the population right now, is my understanding.
Yes, that test will be available. We're planning on filing on that test within the next 4 to 5 weeks. We'll be filing our application for the antigen test. And again, we're going to differentiate between the two different types of antigen, the N and the S1, so that way we can decipher how well we know that being a definitive type of test, the antigen test will give us an active test, which very similar to your influenza test. It's the same type of technology. So the technology has been around a long time, and we're just applying it to this very specific virus.
How long do you think this test will be around for after, it's created and developed?
We actually believe that the new COVID, unfortunately, is going to be around just like influenza. It's going to be around for years. This test, unfortunately, the testing is going to be around for decades, as we know that the COVID virus is going to be around for a long time. It's not going away. It's going to be just become another, basically, it's going to become another influenza or strep test.
And
it's going to be something that's going to be commonplace.
And that's why this new antigen test is very important for all of us as just, medical providers and everyone else, is because this test is going to be around, like you said, possibly for decades, which means that, this is what we're going to be expanding on and perfecting for the next decade.
That's correct.
Well, in my field, I love cutting edge stuff. So for me, it's very exciting that you have the antigen tests in production and soon to be released. And just for people that don't understand what that means, it's going to be much like when you go to the doctor to do a strep test or the influenza test. It is a swab. They are putting it in your nasopharynx, and you will get the results in minutes. So it's relatively easy test, as opposed to the antibody test where it's a blood spot where you take just like a finger stick, and you still get the test in minutes. But the difference is the antigen test is going to tell us if you are actively infected. The antibody test, you have to wait days for there to be a positive test, because in the antibody test, it tells us if your body has mounted a antibody response. And we're not certain how much immunity you have to coronavirus. It just says that your body has actually mounted a response, and we don't know how long that immunity lasts. So in terms of trying to understand the pathophysiology of this disease process, the testing is going to be very important to figure out how long your body's actually immune. So as a doctor, I really appreciate that you're keeping the test affordable for patients, because I know I get the testing for you, and in my clinic, I'm not even charging anybody for the test. The COVID antibody test is free for my community. They just pay a low copay for the visit, and the testing is free, because I really think it's so important to have the people tested so they know how we can handle or recognize people who are infected, so they can stay home, so the people that are not infected can go back to work and go back to school.
Yes. And by using the antigen test, we'll be able to actually help people get back to work.
And that's what we want to do, is help the community, make sure that the community is safe with these tests, so that, like you said, get everyone back to work, get the economy rolling again, make sure that, children can go to school.
Yeah, get it safely done.
So why do you think the antigen test, you said, is going to probably take about 4 weeks for it to come out? And is it going to be available in other laboratories, or you're going to go to the private clinics? How can people find out about the antigen testing and how they can get it done?
As soon as we are able to submit with the EUA, with the FDA, I'm sure it's going to start off with labs. And then our goal is to be able to bring it to clinics and to physicians that meet the FDA guidelines and requirements. There's two different types. There's high complexity and moderate complexity. And we're hoping to be able to get into the moderate complexity, which is most places that do other clear wave type of testing. If they do testing for influenza or strep A presently, we should be able to sell to those physicians, which will be able to get it to the community. And now we would be able to have a lot of people tested quickly, efficiently, and truly with a better understanding and result.
Do you think that this would be available for before school starts, so that the community can hopefully reopen schools?
I'm going to try. We are trying really hard to have this available by the latter part of August. It depends when the schools start. If they start in mid-August, no. But if they start the first week of September, we may make it. We're trying very diligently to be able to have this test available. And once it's gone through our clinical studies and third-party studies and third-party labs and studies and confirmations, then we submit for the EUA, and then we turn around and we will be able to give notification that we're looking to sell the product, to sell the antigen test, and then we'll try to make it available quickly. We have the capacity and the manufacturing capacity to be able to make quite a few tests very quickly.
In case people don't know what the EUA means, that stands for Emergency Use Authorization. And so the usual process is to have the test cleared by the FDA. Because of the importance of getting COVID testing out there, they've kind of sped up the process, the FDA, with the so-called EUA, or Emergency Use Authorization. So you don't have to go through so much of the red tape. Is that correct? To get the testing out there sooner?
No, that's exactly correct.
Yes, because I think it's very important that we still have testing that's safe and accurate. Unfortunately, some of the testing that came out earlier, there was a lot of false negative. So people that were not sure that if they were still negative or positive from the test. So I'm happy to know that you are having much better results and much better accuracy, because I think that the testing is going to really help us to identify which people can get back out into the community. And I'm really excited about that.
Well, we are too. We're excited about having the opportunity to help people, number one, and number two, be able to get people back to work and children back to school and get everything moving again. Let's not get beat by a virus, basically. We have the technology and ability to do its proper, and then also by testing to make sure that we follow the proper guidelines that we need to, so we can defeat this little virus and get not just our community, but there's people all around the world that are suffering horrifically. And so we start at home and we go abroad.
Talking about schools, luckily, well, as you know, that I'm hustling and I'm going out there and talking to clinics, talking to urgent cares, because I'm part of the sales coordinator team. I am a sales coordinator, and luckily I was able to get in contact with one of the high schools and soon speak to, actually, hopefully we can have a sit down and talk about it, but the superintendent of one of the high schools in Mission Viejo.
Oh, nice.
And meaning that when I did go there and I spoke to the receptionist and the people up in front, they were letting me know that schools will be opening in September. That's what their goal is. And they are saying that it might be later. So seeing that the antigen test will be hopefully ready as best as we can make it by September, that gives us an opportunity to sit down and talk to these people, like the superintendent of these high schools and superintendent of colleges, and let them know, hey, this is what we're coming out with, and it will help you more efficiently open up your schools.
I mean, that would be great. One of the limiting factors before was the availability of the reagent or the swabs. Do you think that that's going to be a problem or a deterrent to get the testing out there for everybody in the community that will need the testing, Charles?
Well, for us, acquiring the antigen to create the antibody, it was available, just that unfortunately, some of the groups that were selling the antigen, for quality antigen, they increased their price by 300%, which was a little gouging in my opinion, but it is what it is. So for us, we're not buying antigen, we're buying the antibody to create the antigen test. And then we've decided to lock down already large quantities of sampling swabs that we'll need.
Perfect.
Because we do PPEs now. And so we have the contacts and the ability to lock down large quantities of the collection swabs.
Well, I think that that's a great community service if you can get the testing available, because I know that a lot of teachers are fearful of going back to school if they can't reopen safely. And of course, a lot of the kids, even though we've kind of not stressed how the kids also not only get the virus, but can also have unfortunate sequelae. In the beginning, we talked about the kids being as carriers and really didn't talk about them getting sick. And
Right.
unfortunately, we've seen so many children now and teenagers that don't do as well as we thought that they could do. So I think it's really important not to underestimate the gravity of this disease and make sure that we keep people safe. So I appreciate that you have that testing available to make sure that kids are not going to be vulnerable, because I think that's the parents' fear, that they're going to open up schools and their kids could not only get the virus, but die from the virus.
That's correct.
So
we're actually creating a back to school packet, and we don't have all the details on it yet, but when the children do go back to school, we want to make sure that they have everything that they need to be safe. And then if we can use that in conjunction with testing the children with an antigen test, then they would be tested in and have their little back to school packets together, and we would be able to help protect from the little ones to the big ones, from the kindergartens and pre-Ks all the way through high school and college, because the classrooms in elementary and high school may be 20 to 35 children, but also in colleges, sometimes there's a few hundred young adults. And we also don't want that to spread throughout the colleges. So we want to have a back to school, and it doesn't matter what age group they are, they all need to be tested and be prepared for, respect for the community, number one, and also to protect themselves.
I also want to give a shout out to all the mothers and fathers that right now are not only being parents, but being teachers for your children. And, I know that it is hard for you guys because a lot of people still have to mount their job and their work, and at the same time take care of their child and teach them and be that teacher that, your child usually goes to school if, you're in elementary for like 6 to 8 hours a day. And during that time, they have a, teacher, someone who is professional that can give them all the direction that they need. And here you are now taking this task and taking this role on top of being a mother and a father, and as well as a provider for the family, making sure that they eat, making sure that they do all the stuff that normally the school system takes care of during that period of time that a lot of parents are working. So I just want to say that, thank you for doing your best, and that we hope that we can make sure that we bring out this test and we make sure that testing improves and the quality of testing as well as the amount of tests that are out there, so that you can go back to work and your child can go back to school and you can come back to this normality and rhythm that you had beforehand.
I mean, it's going to be a total game changer if Global Health can really, administer the tests and get the testing that we need, because that's what I want as a mother, to know that if I bring my kids back to school, that they're going to be in a safe environment. And
That's exactly right.
And I think that the work that you're doing is very important work. And I'm very excited about getting the antigen test myself. Make sure I'm going to be one of the first on your list, please, to get the test, because I will definitely have that in my clinic. And I'm really looking forward to how we can beat this virus. I really believe as a community, we are stronger than the virus. And I
That's
know
right.
that people are afraid. There's more anxiety. And I do just want to say before we leave, because our time is coming to an end, that I want to remind people that we still have our poetry short story contest to help destigmatize mental health illness. And we are giving $500 cash prizes for people to share their poem or their short story on how they cope or live with anxiety, depression, or a mental illness that they either suffer or somebody in their life suffers. I know that COVID anxiety is a real thing. I see it every day in my clinic. And I really want to let people know, especially the teenagers, that you are not alone, that there are a lot of people that feel scared, that feel anxious, that feel depressed because they're not going back to school, because they're isolated. And it's very fearful when you're alone and isolated and you don't have people to talk to. So I think having this platform of having the poetry or short story, please send them to me. The deadline has been extended to August 15th. So the deadline was going to be tomorrow, July 31st, but now it's going to be August the 15th. So we really want to make sure that people can get the poetry and their short story, and they can email to talkwithbrett@gmail.com, or they can email to me, staff@drmelindasilva.com. And you can see my email on my website and drmelindasilva.com if you forget either of those. But I encourage everybody to participate. And I just want to say thank you to our guest today. Thank you so much, David.
Thank you.
Thank you so much, Charles. I know that
Thank you again.
I'm very happy that your company is on the forefront of this. And I'm really excited to hear more, get more about the anagen testing. I can't wait to have it in my clinic. I can't wait for the community to have it so that we can get people tested and recognize where this disease is at, so we can get control of it. And I'm so happy that you're able to join us. So this is Dr. Melinda from Aging Gracefully and Strong, bringing you cutting-edge trends in holistic and integrative medicine on IQ Podcast at King Studios.
I did want to mention that if you have any questions for me or my father, you can contact me directly at David's DIVID S at gwhp corp.com. And you can email me and get a hold of me. And if you need any other information, you want to talk about something, I'm available. Just send an email.
Thank you.